So I came across this workshop, and it was called, well, training, not a workshop, but a training that was called Healing Trauma with Hypnotic Experience. And I got really intrigued. So I took the workshop, and that was, with the training. That was a weekend training, and that was introduction to rapid resolution therapy. Well, the name kind of speaks for itself, because rapid resolution therapy is aimed to heal from any kind of traumatic impact within one session. So it's done on a conscious and unconscious level. It's a very complex but really fun process. It's really lighthearted. We look at it in our practice. We look at it that it's the therapist's job to, if the person comes to see me, it's my job to make the shift for them, or to create a shift for them in the way that they're satisfied, they're happy with the results, and they're satisfied over time. Originally, it was developed to treat sexual trauma by Dr. John Conley. He's the founder of the process. Eventually, it evolved in treating developmental trauma, shock trauma, anxiety, depression, heartbreak, grief, nightmares, anything you possibly think of. We address everything in RT. And again, this is designed for people who are not interested to go into therapy consistently, but interested of feeling better right away. As I mentioned, it's a lighthearted experience. It involves me explaining to a participant how the mind has been working. I include the stories that, again, work on the unconscious level. I take people through the eyes closed processes, again, all aimed for the unconscious shift. We explain in a way that is how the mind has been processing information, and we're interested in making sure that the mind has processed information all the way through, where if the mind is no longer reading that it needs to be doing something about what have happened before now, then the mind is not signaling by creating a thought, emotion, or sensation in the body.